Hi there, you're welcome to RX Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at RX Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at RX Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. All right, so what is our medication today? Our medication of choice today is Lactobacillus GG. I like calling the name of this medication, especially the generic. So this medication is a brand name known as Culturelle. So like I said, the generic is Lactobacillus GG, and this medication is used as a probiotic. So this video is also going to be in compilation in terms of patients who are also taking the Align probiotic, which contains the Bifidobacterium infantis. Yep, mouthful. Align and the generic name is Bifidobacterium infantis, and this medication can actually be used, other than being used as a probiotic, as a treatment for IBS, which is a treatment for irritable bowel syndrome, as well as for bloating, diarrhea, nausea, and cramping, as well as UTI. So a probiotic pretty much is there to help for any stomach support or digestive support. So what it does, it kind of increase the normal bowel flora. So there are certain bacteria right now in our stomach which are termed as the good bacteria, and pretty much what they do is they help with the production of vitamin K, they help with the breakdown of food, they help with the absorption of nutrient from the food that we eat, as well as fighting off the bad bacteria from the food that we do eat. So if you've probably had a meal, it's probably been out for, a minute or so while you're cooking it. There's dust all around the air. Things that get in contact with our food, and what the good bacteria in our stomach actually does is when you take that food that has probably been contaminated with dust or some form of bacteria, the good bacteria is kind of there to kind of support the immune system, or to kind of, so the good bacteria is there to support the gut bacteria. So the good bacteria is actually there to support the gut. That way, the bad bacteria that you're taking from the food that you eat doesn't overpopulate and kind of disturb the normal system or the normal gut function, which is your stomach. So this medication actually ranges between doses of 2.5 billion of, bacterial cells, or bacteria units, to about 15 billion, units of bacteria. So like I said, the probiotic is actually the good bacteria that's kind of made into a pill to kind of help restore your normal stomach function. That way, if you do, have some gut bacteria or some stomach infection going on, that can kind of help support the already good bacteria that's in your stomach. All right, so I hope I was able to break that down in terms of what a probiotic does. So in terms of how to use this medication, so patients will normally take one tablet once a day or twice a day, depending on how your doctor recommends this probiotic, or depending on how it states on the label of the medication that you decide to pick over the counter. So what are some of the side effects of a probiotic? So some side effect of the probiotic is bloating. So at times this the probiotic can cause bloating, it can cause diarrhea, it can also cause gas. So these are just some common side effects from taking the probiotic. In terms of the Align, patients usually take this medication as one tablet every day. So same side effect applies. So patients will notice flatulence, patient may notice some bloating, as well as some diarrhea while taking this medication for Align patients. It doesn't always happen to everyone, but just in case if it does, just be on the lookout. So who are patients that cannot actually take, or it's not recommended for them to take a probiotic? So these will be patients who are immunocompromised. So these are patients who already have a weakened immune system that you kind of don't want to disrupt how their stomach or their gut is already functioning. It's kind of like their stomach is already in that flow of things, and just taking a probiotic might kind of dysregulate what's going on. So usually in these patients, they will recommend not taking it. So for immunocompromised patient, I am talking about patients who have HIV, patients who have type 1 diabetes, patients who have cancer. So these are, like I said, patients who kind of have some underlying serious condition going on and their body is kind of readjusting to it. So you don't want to take a foreign, bacteria that can now, disrupt the whole flow of things that they have going on. So in terms of what to look out for while taking this medication, so this medication should be taken about 30 minutes before breakfast. Also, patients can take it, like I said, once or twice a day. So if you're taking it twice a day, you just kind of want to take it way before you take your meal. And also some patients may decide to take a 14-day regimen, every now and so often, but the recommended way to take the 14-day regimen will be 14-day regimen every 4 months. So like I said, our stomach is already doing that function of kind of getting back to its normal flow of things. So you don't want to keep on taking a probiotic because it wouldn't make that much of a difference if you use it way too much. So you kind of disrupt your stomach, and it's kind of like you don't want your stomach to always depend on a probiotic in order for it to be able to perform its regular function. So for patients who are taking the tablet or the capsule, except if it's a chewable tablet, it is not recommended for you to chew or crush this tablet. You want to make sure you're swallowing with a glass of water and taking it as prescribed. Also, if you're taking an antibiotic or an antifungal medication while you're taking your probiotic, you want to make sure that you're separating it about a couple of hours. So depending on the antibiotic or depending on the antifungal that you're using, that's what's going to actually require how many hours apart you want to take it from the probiotic. A general rule of thumb is probably to separate it about 4 to 6 hours. Give the antibiotic some time to work before taking your probiotic. And if anything, make sure you just complete your antibiotic and then start the probiotic. At least you're done with your whole course of therapy and the infection has subsided, and then you can try to replace your flora with some good bacteria. All right, so in terms of the capsules, if you're not able to swallow the capsule or you're having trouble swallowing, then you can actually open up the capsule and mix it in with a small amount of cold food. So maybe like a cold applesauce or, a cool drink. You can kind of mix it in with that. You don't want to mix it in with something hot. So definitely a cool food or a cold drink. You can open up the capsule, pour it in there, and kind of mix it together before taking in that medication. Also, in our patients who are less than 3 years old, it is not recommended for them to taking. It is not recommended for them to take the chewable tablet. So make sure you're on the lookout for that. If you are giving your young child a probiotic over the counter. Also, in terms of the antibiotics in general can alter the normal flora, and it can actually cause like a secondary infection, usually after patients are done with an antibiotic therapy, not probiotic. Usually when patients are done with like an antibiotic therapy, like penicillin or amoxicillin. Sometimes in some patients, depending on how strong the antibiotics are, it can actually go on and cause a secondary infection. So remember, you're taking an antibiotic, which is very effective, and it's going in, it's trying to kill the bacteria. Of course, while it's trying to kill the bad bacteria, some good bacteria are probably going to suffer. So in that case, they recommend taking a probiotic to kind of increase those levels of good bacteria that are already in our gut in order for them to kind of get back to their regular flow of things. So I hope I was able to explain this to you in a good way where you're able to understand the essence of a probiotic, what to look out for, as well as things to do while you're taking the probiotic. Thank you so much for staying here up until this point. If you haven't yet done so, make sure you hit the like and subscribe button as I mentioned earlier. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. And we look forward to seeing more of you as always. Thank you and stay blessed.